Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is March 12th, 2021. As always, we start with our COVID-19 statistics. Worldwide, we have over 119 million cases and over 2.6 million deaths. In the United States, we have nearly 30 million cases and over 545,000 deaths. COVID-19 new case numbers are still going down, but they're dropping more slowly than they were before. As we get more people vaccinated, we should start seeing those new case numbers continue to decrease, and hopefully at an even faster rate. In the meantime, however, public health experts are continuing to recommend following the CDC guidelines. Again, those are wearing a face mask in public or around anyone that's not of your household, avoiding large crowds, practicing social distancing, and washing your hands. New guidelines were released by the CDC this week for those who are already fully vaccinated. Now, by fully vaccinated, what we mean is it needs to be 2 full weeks after you get the final dose of your vaccine. So if you took the Pfizer or Moderna vaccine, that's the second dose is your final one, so 2 weeks after that. If you got the Johnson & Johnson vaccine, it's 2 weeks after just the one dose that they offer for that. So those who are fully vaccinated, based on those guidelines, you can meet with other fully vaccinated people without worrying about wearing a mask, without social distancing, etc. You can also gather with other unvaccinated people of one household. Do not have people from multiple households that are unvaccinated, but you can meet with one householder or multiple members of one household that are not vaccinated if you are fully vaccinated without having to worry about wearing a mask. The exception to that is if any of the people you're meeting with are unvaccinated and they are at a higher risk of developing severe symptoms to the COVID-19 or of the COVID-19, then you do not want to meet with them without a mask, even though you're vaccinated. Also, fully vaccinated individuals do not need to get tested or they don't need to quarantine either if they happen to come in contact with someone who is positive for COVID-19, unless you start showing symptoms. Like we've pointed out, no vaccine is 100% effective at stopping the COVID-19 completely from you getting it, etc. So there's a chance that even though you're fully vaccinated, you could get COVID-19. So if you start showing symptoms, that's when you'd want to get tested. Otherwise, you don't have to worry about it. So this is all great news, but as we mentioned last week, now is not the time to relax and drop the mask mandates and everything like that. Even though lots of states and counties and cities and health department regions, a lot of them are starting to drop their mask mandates. That's definitely not recommended. The CDC has come out and said, please don't do that. Premature celebrations can often end in disaster. We don't want to give it up on all these things that have helped us get to this point, too early. It's just going to cause problems. So there are a lot of reasons for optimism, and hope can be a powerful thing. But we also need to be aware of reality. So this week I'm going to give some examples of our current harsh realities, but also the corresponding hopes. So one harsh reality we're facing right now is that there are a lot of variants out there that we don't yet know a whole lot about. The things that we do know about them, or things that we think we know about them so far based on initial studies, show that a lot of these variants spread more easily, cause more severe symptoms, and in some cases can even evade or cause vaccines to be less effective, or treatments also. It's not a perfect thing. The variants seem to be worse than the more original or earlier strains of this virus. The corresponding hope that we have with those variants, though, is that so far we're not seeing any huge spikes, even in areas of the world that have a large percentage of the variant in their area. We're not seeing that. We're just not seeing those huge spikes. We did see some spikes early on when these variants first came out, but those spikes could have been related to other things that were going on at the same time, such as holidays and etc. Right now, it seems that vaccines, even though they're not as effective against variants, they're still quite effective in the places where it matters, meaning hospitalizations and deaths. So that's a good thing there. Another harsh reality is that millions of people, even just in the United States, are not following CDC guidelines, especially the wearing of masks. In addition, a new study has shown that wearing a subpar mask, for example, one with just a single layer of material, can actually cause the virus to spread more easily than even not wearing a mask at all. It's because, and this was hinted at in previous studies, but we just didn't have as much evidence. Now we got another study that backs it up. It's because that those subpar masks, single layer cloth masks, bandanas, things like that, they basically take the virus coming out of the wearer's mouth and break it up into smaller particles, which then go out of the mask and are then more easily breathed in through other people's masks. Even if they have better masks, the smaller particles have a higher chance of getting through. Masks, good quality masks will still mostly prevent those smaller particles from getting through, but there's a higher chance, and the chances of you getting the COVID-19 are even higher if both the source of the infection and the person becoming infected both have subpar masks. So definitely upgrade your mask, please. We don't want to be having the things that are supposed to be just temporary things, the simple cloth ones, the bandanas, neck gaiters, things like that. Please upgrade. The hope we see with masks, however, is that there are a lot more people wearing masks now than there used to be. Even in my area, where there is a lot of opposition to wearing masks, just based on my own observations, no studies or anything, but based on what I've seen, it looks like probably about double the amount of people are wearing masks now compared to about 4 or 5 months ago. So it's definitely getting better. People are getting the message. There's still an unfortunately high number of people that have not decided to wear masks, but it is increasing. Another hope that we're seeing here is better availability of good quality masks, whether that's the KN95 or the lab tested cloth ones that have the filters built into them, or even the N95, those hospital grade N95 masks. We're still not completely out of the woods as far as shortages go, but it's getting a lot better. And so those are becoming more and more available. So that's all good news right there. New studies are also giving us more knowledge about what makes a good mask. And there's one that came out this week that just verified what we pretty much already knew, but it's always nice to have a little bit more information, more studies to back it up. 3-layer masks, or even higher than 3 layers, are a lot more effective than 1 and 2-layer masks. That 3rd layer just seems to help so much more. One of the big things about it is that you've got 2 outside layers and an inside layer, and that difference between the layers creates an electrostatic charge, which really helps. You don't get that electrostatic charge almost at all with a 1-layer mask, and you get a very minimal one with a 2-layer mask. 3-layer mask or even higher can give you a very good electrostatic charge, which attracts those particles and sucks them into the mask basically, so that they're stuck on the mask, not going through into you or out from you, out into the world. They just get stuck there on the mask. So definitely upgrade your mask, like I said earlier. Another harsh reality is that we're short on vaccines. And there have also been some reports of possible serious side effects to some of these vaccines. The hope on this, though, is that the side effects that we're seeing are very, very rare. We're talking like 10 in a million, on average, for most of these side effects, or lower, sometimes even 1 in a million. And the thing is, we're not even certain yet that the vaccines are causing these side effects. Because there's such a low incidence, we just don't have the raw numbers we need to be able to tell if this is really the cause or not. One thing to keep in mind, though, is that as more people focus on vaccines and focus on health in general, focus on COVID-19, you're going to have more people noticing when things happen, when they experience certain symptoms, etc. And so the number of incidents that we're going to see is probably going to go up regardless whether you got the vaccine or not. Also, another thing to keep in mind is that those who have gotten the vaccine so far are mostly the older individuals, 65 and above. That kind of age range is most of the people who have gotten it so far. And they are more susceptible to most health issues anyways. And so it could be the vaccine, it might not, we don't know. Either way, it's very rare. So you are definitely better off getting the vaccine than not getting it. We also have a hope that we will see an increase in production in the vaccines. As of right now, in the United States, we have 3 vaccines that have been approved already, Pfizer, Moderna, and Johnson & Johnson. AstraZeneca is very close to being approved, hopefully by the end of this month, maybe early April, we're not sure yet. Either way, we should be having that fairly soon. As it is right now, we're over 2 million a day vaccines being given to people on average. We're getting close to the 3 million a day, which is the goal. And if we can get the 3 million a day, that'll make things speed up quite a bit as far as getting people vaccinated. Currently, if every adult, if the production stays the same, every adult in the United States that wants to get a vaccine should be able to get one by May 1st. We should just have enough vaccine available that would be the case. Barring any other major issues or anything like that, May 1st is the date we should have enough for everybody. So that's amazing news. It's not that far off. Currently, there's a patchwork of rules throughout the United States on who can actually get vaccines currently because of eligibility things. The states are basically the ones that are in charge of all that, and each state decides differently. CDC did release some rules about that, or some guidelines, about that, but the states don't have to follow those guidelines, and unfortunately many are not. But thankfully we do have a federal plan for this also. There's a federal program that's mostly being administered through retail locations such as Walgreens, CVS, Walmart, things like that. And those bypass the state eligibility rules. And so if the federal program says you're eligible, you can, but your state does not, you can go to one of those locations and still get a COVID vaccine. Now, one of the big things with that is teachers. Teachers from kindergarten to 12th grade, you may or may not be eligible in your state, but the federal program, as of earlier this week, has said that anyone that's a teacher, K through 12, is eligible to get a vaccine. So if you're a teacher, please go to a retail location or at least go to their website and schedule something so that you can get a vaccine as soon as possible. Another hope about vaccines is that they do really look like they're working. All the studies that we're seeing and real life results, the dropping in case numbers, other things like that, we are really seeing that these vaccines are working. They're especially effective in stopping the things that matter most, the hospitalizations and the deaths. And so that's a huge benefit. So definitely, once you can get your vaccine, please get it. It doesn't matter what type it is, just get whatever's available. They are all good. They are different. They do have different levels of side effects, etc. It looks like the Johnson & Johnson probably has fewer side effects than the other two. It has lower effectiveness as far as just keeping you from getting COVID-19 completely, but they're all good at keeping you from being hospitalized or dying. At this point, the differences don't make that much difference. The main thing is get the vaccine when it's available to you, regardless of which vaccine it is. The final harsh reality I want to mention this week is that many of the promising treatments for COVID-19 just haven't worked as we wanted. We've mentioned tons of different failed ones in previous reports, from hydroxychloroquine to ivermectin, all sorts of them. Lots of them have not worked. In fact, this week we found out more about convalescent plasma. That's where you take the blood plasma from someone who's already recovered from COVID-19 and has those antibodies, and you put it into someone who's currently infected with COVID-19 in the hopes that the antibodies from the plasma will work in this new patient's plasma and cause the infection to go away more quickly. Unfortunately, that's not working. The studies show that it just isn't really making any difference at all. So that's kind of sad right there, because that was thought to be a big help, but unfortunately, it doesn't seem to be working out. A hope for treatments, though, is that we do have many that do work. Dexamethasone is the huge success story. Some of the monoclonal antibody treatments work, depending on whether it's early in the process or later, if it's severe or mild. Some of them don't work as well, some of them work better. But we do have quite a few things that do work. And some of those aren't even just treatments, but just methods of dealing with patients that are helping. One big thing that we found out this week in studies, and it's something that's been suspected for a while, but we've got a study now that has results that show that, yes, this is true, is that statins, basically used for cholesterol medication, they help to decrease the risk of death in COVID-19 patients dramatically, up to 50% decrease. That's huge. So that's a really good thing. And so we do still have even more treatments that are either not available just yet, or they're just barely becoming available. But we've got tons of treatments that are in the pipeline being studied. They're going to be available. The vaccine is coming that will make a lot of these treatments not even necessary, but there will always be some that will still get the COVID-19 even with the vaccinations, just because we don't have 100% effectiveness. And so those treatments will still be good. So we do have all that hope there. So there are a lot of not so good things about our current situation with COVID-19, but there are many more things to hope for. Please don't give up on the COVID guidelines, or the CDC guidelines for COVID-19. We just can't stop now. We need to keep following those guidelines. We need to get the COVID-19 vaccines when they're available to us. We just need to continue doing this for a little bit longer. We want to return to normal. President Biden's goal for normal life in the United States is July 4th of this year. Of course, that's a bit of propaganda, being Independence Day and all, but the science does back it up as long as we work together and we do our part. If we don't do our part, it'll probably be a bit after that, maybe early fall. But let's shoot for July 4th. I would be excited to have a barbecue with friends and family that day without having to worry about masks or anything like that. So let's try that. So thank you for watching the Plain English Public Health Weekly Report for March 12th, 2021. As always, we've got lots of links down below the video for things that we weren't able to get to today and for more information about the things we did talk about today. I'm Richard Greenland, and you have a healthy weekend.